now is Rena Hearer, who is talking about Bell Let's Talk Day, and you've been talking to a lot of guests this morning on this very issue, talking about some very interesting statistics. 1 in 5.
1 in 5 people will deal with a significant mental health issue over the course of their lifetimes. And Dr. Katy Kamkar from the Center of Addiction Mental Health joins me now. We listened to Claire Hughes, such a passionate speaker, such an honest speaker.
Exactly.
And one of the things that we talked about, she's out there talking to a bunch of secondary school students. So, you know, young kids in their teens.
Yes.
And you said that's when most mental health issues take root. It's during that time.
That's exactly what we need to pay attention to, because it is true that 1 in 5 Canadians will experience a mental health problem during your lifetime, but 70%, again 70% of mental health problems onset in childhood and adolescence. So it's very important to be cognizant of the symptoms and to really seek treatment as soon as possible for really prevention and to have a better quality of life.
We also talked about the fact that, especially with teenagers, sometimes parents can be a bit dismissive. Hormonal, they're teenagers act like that.
Very much. So we can really dismiss it easily.
Yeah, and not just with teenagers. How do you know whether the adult in your life is when they say, you know what, I'm just not feeling right, I'm feeling down, I'm not able to get out of this funk? When do you know that it's something you should be concerned about? What kind of help can you offer?
You know, when we are stressed, depressed, or anxious, or any other mental health problems, there are some key symptoms to look for. Any changes in mood irritability, sudden sadness, anxiety, fear, feelings of anger, not wanting to engage in the activities we used to enjoy before, abandoning our responsibilities, not wanting to go out or to socialize, we want to self-isolate, changes in our sleep, changes in our concentration, changes in our appetite, increase maybe in suicidal ideation, feelings of worthlessness, or having headaches, muscle tension, abdominal distress. Again, we can have those symptoms, but if we experience those symptoms, most of those symptoms, increasingly throughout the days, throughout the weeks, to the point that they interfere with our functioning, day-to-day responsibilities, it's very important to seek help. It's important to speak with our family, to speak with our friends, and definitely with a healthcare professional, because effective treatment is available. So it's very important for people not to suffer in silence.
And not everybody has the luxury of having a community around them, or supportive parents, or a supportive network of friends, etc. When can you sort of handle it as a concerned parent or as a concerned friend? When can you be there and offer enough help to help someone through a tough time? When do you know you need to consult a professional?
When a person talks about any changes that they have observed and they feel very distressed by it, that's often a very, it's important to talk about it. It's very important to be listened to. And from that on, it will be a good starting point to decide to seek a healthcare professional. It will be very important from that point on.
All right, Dr. Katy Kamkar, it's always a pleasure to talk to you.
Thank you.
Your information is invaluable. Thank you so much.
Thank
and we'll
you.
chat with you again soon.